Well, today I'll talk about the EMV and EDOF IOL. I have no financial interest. So, can I have the slide? Yeah. Basics of no financial interest. So, this is we came a long way actually. This is the invention of the bifocal IOL started in the concept in the 1984. When in the pseudophakic eye, myopic eye, there is a decentration of IOL, and the patient used to see that the aphakic eye for the distance and the pseudophakic eye and the distance, and the first lens came is the fusion of the two optics to 18 diopter and a 21 diopter and 24 diopter. But that's a refractive IOL. Then came the refractive design of resume and array, and then diffractive, and coming again we are towards refractive one. So if you correcting the presbyopia correction, if it's a trifocal, give you full correction as we said, and if we consider EDOF, it will correct the partial correction. So another the concept is what EMB, extended depth of focus, or enhanced monovision. What are they? So, extended depth of field intraocular EDOF is a consider the lens as a definition. It will give at least 0.75 advantage in the near. So, then it is called EDOF, and it is create elongated focus rather than a multiple foci. So this concept, though the enhanced monovision is there is no definition is available in the literature. What is enhanced monovision? But there is a definitely definition of extended depth of focus. So far we have a two diffractive lens we consider as a EDOF, that is a Symphony and Attilara. But over the year, there is a concept, the change. Now there is amalgamation of the what is EDOF or EMB. There is a lot of lens which is available in the market, starting from small aperture IOL to manual, that is by manual Proxa by CFI, iHands by Johnson & Johnson, VVT by Alcon, PRC by again Johnson & Johnson, Vivinex Impress by Hoya, manual Proxa by CFI, Ray1, Isopure by VVI, and AdTech Comfort by AdTech in the Indian market. These are all the lens. So, what is aspherical and spherical lens is? The spherical lens and aspheric lens, there is a difference. Spherical lens create a elongated for the loss of light. That's why this came. If you see the optics of the spherical and aspherical lens, see, if it is spherical lens, from the center to periphery, the spherical lens 20 diopter. So, if it is an angle of light is a different, then it give a defocus. But what is in aspheric lens? It is if it is a 20 diopter lens, and the periphery it is actually 19.1. So, it give a sharp focus. So, this is the spherical aberration which is give some elongated focus. The most of the company actually EDOF or EMB actually playing in this game. So, what is now? It is a perfect rate and a channel focus rate. These diffractive loss of light, they actually play to utilize this loss of light for the EDOF technology. So, what is the ideal EDOF? Ideal EDOF should be that the light would be in the channel, the small channel, so that there will be less halo or diffraction. So why it is came? I am just showing two picture. If it is a diffractive lens, you can see that this is one foci here and another foci here. But the light from the first foci passes through, and the second foci, these light causes halos here. So this is the main problem, to make a channelized focus in the EDOF technology. So now this is whatever the EDOF waveform shaping, what is the spherical aberration or refractive design, J started to make a channelized one so that there is a loss of light less and create a loss of less halo. This technology actually concepted from the aperture lens. These came first. EDOF lens is actually the aperture one, small aperture lens. But there is a loss of field, that's why it's not popular. So, but the concept came from the aperture lens to now the wavefront shaping lens. I am talking about the central active zone. So, they make the central active zone is very small, and it is their playing game how to make a small region of the central zone, active zone, so that it able to focus, it creates the elongated focus and rather created less loss of light or created less halo. But these are they are making, and these are the actually their mode of action, how they play the optics of the lens. So came to the first eye hands. Eye hands is a beauty, it's a very small spectral zone. That's why sometimes it will not, patient will not see the effect, and doctors will not appreciate the effect because they have created the sharpness, curvature of the lens, and it has a very small central zone. As it is a very small central zone, there is a less number of halo and the glare in this lens. I am not going to detail. So it is called as a EMV, enhanced monovision. It is intermediate, gives the advantage of most of the time 0.5, not point more than that, and very good in the distance vision. So came to the evolus of the CF lens, and it is actually played in the spherical aberration followed by negative aberration into the anterior surface. The zone is almost 2.5 millimeter in the central zone, and 4 active refractive zone is with spherical aberration opposite side is distribution in the central zone. So this is give you the very good intermediate distance, but not as good as the distance like eye hands, but it is definitely for intermediate action, it is definitely give you +1 advantage, and it is for the intermediate or EMB. If you consider EMB, it works better than eye hands. Now came to the mini OL technology. This is a EDOF lenses. This is made of hydrophilic lenses, and this is the technology. It has a central positive aberration, spherical aberration, followed by the negative one, and then the power. This is very good EDOF lenses. Central, it has a 3 zone D1 2 millimeter, D2 is a 1 millimeter, D3 is a 3 millimeter. These are alternate spherical aberration, created the elongated focus into the channel. You can see the channel is this. There is a loss of less halo, less loss of light, but it is able to give you very good focus in the intermediate distance. So if you consider, it's always, most of the time is always in between +1 to 1.25 advantage for the near. CF is very good, and it is a intermediate vision, almost N6 at the 60 centimeter, and distance vision. Again, if you play with the central part of the any optics, it will give some kind of disturbance, inferior quality in the distance vision compared to the aspheric lens. So it is a good distance vision, but not as good as distance vision like eye hands or Evolux. Now came to the Rayner one. This is a very interesting. This is a non-diffractive design, blended edge with the reduced longitudinal spherical aberration. This is the same concept used by the CF, but it is a blended properly, and this is a design by the Graham Barrett. So it is a give a channelized elongated focus, which is give you 1.5. Then this is the beauty of the lens. This is the central part is a very small, so it is a very less halo, almost no halo. So it gives a advantage is almost less than the, I call it less than the CFI's mini IOL, but it is a give advantage of 0.7 most of the time. It is for the EDOF, EMV, it is considered EMV, but it is give a better intended vision compared to eye hands. Now came to the wavefront shaping, Z wave. This is stretching and shifting. So looking, this is a VVT. I go not going to the detail of the technology, but this is a 2.2 millimeter zone in the central zone. So if you consider this, it's a very good EDOF lenses. But if you consider it's a aspheric design to Clarion, it is inferior for the distance vision and creates some kind of halo many patients. So if you consider advantage, I am going VVT, it is most of the time it is +1 advantage, and many times it's give you +1.5. That means patient may need 0.75 to 1.25 for the near vision. Viviness Imprex also is it's slightly different technology. Again, it is create elongated focus. Is the central 2 millimeter has a smooth combination or even order standard aspheric surface, and the peripheral part is standard aspheric surface, but central part is the spherical aberration creates some elongated focus in the central part. Its optics looks like this, and again as I said that these have a give it's a very good distance vision, Vivinex Impress, and it give advantage of 0.75 of the near. So Vivinex Impress is considered as good as distance vision like eye hands. Now this is a new lens in the PRC. This is they called is a refractive. Central zone is 1.2 millimeter. So and it is considered as a EDOF, and technology it is a refractive surface in the posterior surface and aspheric design in the front surface. So it is a very good lens, and most of the time is a give advantage within 1 to 1.75. It's a very good for the EDOF, considered to EDOF. So isopure, this is another lens from the BV high, which considers a very good very good distance vision and advantage of 0.5, 0.75, intermediate 70 degree. It is 67 to 68 degree. I call it 70. It's almost most of the time it's a give a N8 to N10. So I am discussing all the, now it is I think I crossed the my time, so I'll not go detail once again. This I just end up my top with one Indian lens. This is a very good for intermediate vision and is a AdTech Comfort by AdTech company. This central zone, it is a pure refractive one. Very small central zone, it is addition is at +2.5 in the central zone, 1 millimeter, and central 1 millimeter, but they blended the optics so nicely, it do not have any kind of halos and glare in the distance, but most of the time it is a give advantage of +1 in near vision. So thank you so much.